Hi everyone and welcome to One Autistic Person. Today I'm going to look at something a bit different, which is medical gaslighting. It's something that I've been kind of aware of, that's a thing, but I think as an autistic person sometimes I struggle to be able to communicate the way that things are, and I can't necessarily pick up if somebody's trying to sort of push me in a different direction sometimes, and especially with authority figures like doctors. And it's only recently that I've sort of realised that this does happen quite a bit. And I just want to share my sort of experience and my opinion on this and why it happens. Certainly in the UK, I can't really talk much about other health systems, but from my understanding of it, this is problematic kind of across the world. But I think there are some very niche reasons why it happens in the UK, which I will get onto. So what I'm going to have a look at in this video is what medical gaslighting is, why does it happen, when does it happen, where does it most likely happen, how can it happen? How does it happen? How can it happen within a medical setting? How to tackle it? That's what I'm gonna look at today. As always, this is my opinion. This is from my lived experience. This is not about everybody's experience, but it's just me sharing my thoughts on this, so people can share their thoughts if they want to share their thoughts on it, but also that they're aware that this does happen, and looking at some ways of how I'm dealing with it now that I've become aware of the fact that it does happen. So first of all, I'm going to look at what medical gaslighting is. So medical gaslighting is when you speak to a medical professional about concerns, symptoms, or worries that you have, and they brush it off as something minor. They tell you you're overthinking it, or that it could not be possible that you have that condition because it is so rare, which I'll get onto in a little bit because I think that's very specific. And it's something specific that I've come up against, which turned out to end up with me having a diagnosis of that really rare thing. But I'm going to sort of look at why it was seen as rare when actually it isn't as rare as it appears when you put other factors into it that isn't necessarily being put there. There is a saying that goes something like, if it has hooves, it's likely a horse. And it's kind of seen as that's how doctors, especially GPs, look at things. And in fact, if it has hooves, it isn't always a horse. It could be a zebra. Though rare, they do exist. And you may not come across them very often, but it doesn't mean that they don't have hooves. So it's, as well as sort of doing that and sort of telling you directly that that isn't what it is, or that you're overthinking it. The other thing that can happen is not updating notes so they can't be referred to back to later. And I have noticed this happen quite a bit over the last few months, but also pre where I am now, they are updated all the time now. And it tends to happen quite a lot when somebody has researched for themselves what their symptoms mean. And you've got to remember that doctors don't know everything. So you are going into a situation where it's their professional setting, and then you're telling them that you think it's this thing. And actually, if you have done a lot of research, as a lot of autistic people do, but a lot of people do in general when they think that they have a condition, it can lead to you knowing for certain, or as certain as you possibly can be without any tests that are relative to that condition. It can mean that it's quite a long time till you get that diagnosis. And if you know that there's something wrong, that there is an issue, it can cause stress, and it may get worse, especially if it's a degenerative illness, or one that makes that may have negative conditions developing in relation to it. And this is where my diagnosis came into things: is the EDS is really, really rare. And I will go in, like I say, we'll go more into that later. But when I was able to put everything forward to this very specific doctor that I now see all of the time, she was intrigued by why I come to that conclusion, and we had a decent conversation about it. So it can cause a lot of stress, because because you've done all of your research and you know your symptoms are falling into that, it becomes really, really frustrating. So I just wanted to then look at some other bits. So why does it happen? And this is just my opinion. Obviously, I can't be sure that this is why it happens, but it makes sense that this is. And this isn't against GPs. It's not saying GPs are wrong for this necessarily, but lack of knowledge from a GP who is a gatekeeper to referral, this can play a key part. They may worry, they refer someone who does not have the condition, and this may be seen negatively from the people that they've referred to, and it can look negatively on the GP practice if they're over referring. So this is why it's really good, really important, and a really good practice for a GP to have a good relationship with their patient, especially if they think that there's a condition, that you kind of start trying to see the same GP if possible, and that seemed to really help with me. And to look and do more digging and test the theory that you've gone with, and not just go, no, it's not that, it can't be that, it's so unlikely. I also think it happens because of bureaucracy, having to jump through hoops, as a doctor once said to me, and that was more in relation to mental health. I wasn't prepared to. I now pay for my own private mental health care because I wasn't prepared to jump through those hoops when it came to my mental health. My physical health is a bit different. It's very difficult to sort of easily do that from a private perspective, and it can go into a lot of private cost if I was to do that. I just don't have the money to be able to do it. Old school thought process and practice, doctor knows best. And the thing with that is the doctor doesn't always know best. There are so many conditions that GPs don't necessarily know about, don't know in depth, may never have come across, and may not be making the links to. And also they have to listen to you for them to know best in a situation. You know you best. The doctor is listening to you. You need to make sure that they are really understanding the fact that this is these are all the symptoms of what you're experiencing and what your life experience is. Don't let a doctor tell you you're not experiencing something. Some people may research something and try to fit it to what they want the diagnosis for, and a GP may think this is happening, but there are ways to confirm this, tests, etc. There are always tests that doctors can do that can probably write that off quite quickly. So, for instance, if you're saying, I'm going to go with the EDS thing because that's the thing that's been the most likely thing for me, most recent thing, not most likely, most recent thing. With EDS, there's a lot of testing that you can do, and I thought, well, if I can prove this to my GP, they're then going to send me for referral. So I got the diagnosis criteria for all of them, for the whole test, not just the hypermobility side of it, which she'd already done. And then I went through that test, made sure that the criteria, and I fit pretty much all of the criteria that I was able to test myself. At that point, it was kind of like, it's really obvious. I would have actually got the diagnosis just from the tests that were there. If there was anything else there, then it would have to be tested for. But I would have been diagnosed even at that point. So she was happy to then go ahead. So sometimes it's about educating your GP. And again, I will get into another reason why it was missed and not really seen as something that was likely, and it was seen as rare. Along with GPs, mental health services are terrible for medical gaslighting. I don't think it's for the same reasons. I don't think it's necessarily for lack of knowledge. I think it's more sinister. I think it is because it's easy to, and they're oversubscribed, and therefore they will try and palm you off on just the easiest possible option, which is usually talking therapies, which something like 60% of people don't actually go and self-refer themselves to anyway. So it's really, the mental health services in the NHS is not fit for purpose. It really needs to be looked at. And then money. Obviously, the NHS doesn't want to spend more money on costly diagnosis, as they have to manage or treat that condition. For a long time now, the NHS has been chasing its tail and not looking to prevent things. They are subsequently failing to cure and treat things, and are often firefighting situations that are to some extent their own doing, but also due to money and COVID and various other things. But I do think that quite a lot of it is poor systems, poor investment in infrastructure, that type of thing, and poor investment in people. And when I say the NHS, I don't mean doctors, I mean the actual NHS as an organisation. So I'm now going to have a look at when it happens. So as I've said already, it would usually be at the GP stage. It may happen at other stages, but specialists are often more open to discuss things. That is not to say that it doesn't happen with specialists, but it is way more likely at the stage of seeing your GP. It is generally at the appointment stage, but it actually can be at the dreaded receptionist stage now, more and more so, with cost issues spiraling. Receptionists are triaging more and more. The problem with this is that they have very little knowledge, and that isn't anything about that's nothing that's wrong with a receptionist. I'm not being rude towards a receptionist. Their job is an admin role with some limited knowledge of medical conditions. When things get complex, they shouldn't be triaging. And also, there is a fair few that I've come across that have huge egos and kind of think that they're a they're a quasi doctor, meaning they close the gate and kind of tell you you're wrong and try to find every way to not get you an appointment quickly, even if it is something you need an appointment quicker than waiting 12 weeks for. And then a big place, again, I will not talk positively about NHS mental health services at any point during this because they're diabolical. Psychiatry assessments and mental health pre-screening is a huge gaslighting experience. And let's be honest, who's more primed to be gaslit than someone who is struggling with their mental health? So, and I do truly believe that is the reason why it is done at mental health services. And I think it's absolutely disgraceful. Where does it happen? So like I say, mainly at the GP's office, but it also can be, and it's rarely at A&E, but it can be, again, at that triaging point. It can be that if, unless they are really extreme symptoms that can be measured really quickly, sometimes they don't want to listen to the symptoms you've got, and they may not be presenting in the way that they would expect. And also, they may not know everything about your medical history. So in A&E, it's really important to tell them everything, because sometimes they don't have automatic access to it, and there are certain things that might not be easily passed through. 111 is a nightmare for downplaying things and making you wait for a really long time. And again, especially when it comes to mental health, very recently, it's only very recently that mental health has become a big part of 111. And the two experiences, one that I've had and one that somebody else had, they've both been extremely negative, where it's been at a game ending situation, and it's basically being, well, there's nothing we can do about it. That is how bad it was on both occasions. And it can happen on wards if they're busy, and you can sort of get told in a hospital that you're not as bad as you think you are, and that can be relatively common, and sort of signs don't get noticed again, and sometimes you don't get listened to. And I, again, have personal experience of that, seeing when my mum was in hospital and she was extremely poorly. I did see that. I did see some medical gaslighting going on, and it wasn't until I got up and said, I'm not happy about this, there's something not right here, that they actually did something. So how can it happen? And what I mean by this is, how is it allowed to happen? How does it get past people? So as I say, GPs are gatekeepers to the rest of the NHS when it is a non-emergency situation. This makes it very easy to ignore problems, especially as they see themselves as very busy and underfunded. When I say they see themselves as as that, they are aware of the fact that they are. So it's, therefore, what I have found it feels very rushed at your GP surgery, that there's not really that time all the time to do it. The GP that I now go and see all the time, she does spend time to speak to me about things and go through things, but quite often it feels quite rushed, and that they want to get that appointment over and done with, and they want to be on to the next. Again, bureaucracy. If GPs are worried about too many referrals, then they are likely to stretch it out unless it is something that they are measured on making sure that they do refer. So something like cancer referrals, if they are done late, the GP is seen negatively on the GP, whereas something like EDS, for instance, wouldn't even be picked up as problematic. So, and that's right to an extent. EDS is not intrinsically life-threatening. There are comorbid conditions that can come with it that would be, but they're not directly life-threatening, whereas cancer is, and treatment needs to be started as quickly as possible. So it is right that that's the case, that they're measured against those things, but it does kind of give this out for the fact that other things that are not seen as quite so serious aren't necessarily passed on. Incompetence in general, when it comes to anything other than what they see day to day, GPs are not specialists. And therefore don't have the knowledge. If they have the foresight to do some investigating, things change. For me, it has been a key part of me getting the treatment that I need to get one GP, as I've said, to see me and get her interested in my strange health predicament. So she's kind of as invested in it as I am, and I can talk to her openly about things. And if she thinks it's absolutely not something, she'll go straight away, no, it's not that. We'll move on to something else. But she will also, she rings me when blood results come back, and she knows I've already read through them and that I've looked at every possible thing that it could be, and then I will have deduced what it might be, and we'll have the conversation, and she'll tell me something else that probably I haven't been able to find. So having a GP that understands you, I think that's really important as well with autistic people, is having a GP that actually understands you. Money, there's no money apparently, so no one's really checking, no one's really that bothered. I know that sounds awful, but in truth that is it, that unless it's life-threatening, no one's really that bothered. And even sometimes when it's life-threatening, it's not really being checked up on as much as it should be at the moment. The NHS is in a really, really, really bad state, so I can see why, but it's not acceptable. And mental health care, and just because they're a terribly run service, I can't say enough how bad the NHS service is when it comes to mental health services. So how to tackle it? So these are the things that have worked for me. Obviously, it's not necessarily going to work for everybody. And if anybody's got any opinions on it, please drop a comment and let other people know, because this is a really difficult thing to deal with. So persistence and ask for second opinions. So don't just automatically go, okay, you're the person of authority here, that's fine. No, say, I'm not happy about that. I really am concerned about this. I want it looked into. And that can sometimes lead to being a bit brute forcey, and then making sure that you're going in forearmed. So having as much information as possible to show this is not just you saying something, making diaries of your symptoms, and show them. Even if they don't want to see them, print out the diagnostic criteria and take that with you. That's actually a suggestion that is used quite often when you go to any website for a lot of conditions. So the EDS website says to print off the criteria and take it with you, because GPs may not have ever come across EDS. They may never have come across POTS, something else that I have. They may not have come across those things because they are extremely rare. But it doesn't mean that then they don't exist. It just means that they may not understand the criteria. And that was the case with my doctor when it came to EDS. She was aware of it, and she was aware of the hypermobility checks with the Baton score, but she wasn't aware of the rest of the criteria. She knew there was more, but she didn't know what it was. So we went through it, and there were certain things she didn't even know, and that's why I had to then be assessed separately, because of the fact that there were certain things she wasn't certain about, like the feeling of my skin. She wasn't sure whether it was classed as velvety soft, and she said it does feel soft. She said, but I don't know. It is. But the other thing is insist that notes and symptoms are put on your medical file. This is something that's really important, because I went through a really long stage of looking back on my medical records now, and you can see that there were no notes put on a lot of appointments, and had they been put on those appointments, it would have been easier to look back and sort of see things, both for this, for autism, for ADHD, for all sorts of things. And chase if not done. So making sure that you have your access to your actual digital notes is really important, so you can look at it in real time, so you can see as soon as you've had your appointment whether it's been updated. Like I say, chase if not done. This sounds awful, but the bigger the pain you are in a singular situation. So if you have a health condition that you are concerned about and you want them to look at, the more time you take up, and the more money you will cost the GP. And when you start costing them GP more money, they will then see it as that it's the right thing to refer you, because we don't want to think about it, but the NHS has to look at us as monetary, and that GPs are run separately in a community care sort of situation, primary care situation. Whereas when you're going into to be referred, it's secondary care, so it's therefore something that is being referred to, and the cost sits with the GP wherever they're not referring. So the more GP appointments you take up, the more money, and the worse their stats look for people trying to get appointments. So it's a horrible way to think about it, but in reality, it's the best way for you to be able to sort of start being listened to, if you truly believe that you have a condition that you need to be looked at. So I kind of touched on this a few times, and it's the rarity reasoning. And the thing that annoyed me with this is because I knew EDS was rare. EDS is extremely rare. So some EDS, there's 13 different types of EDSs. Certain EDSs is 1 in a million that you will have it. That's not what I have. I have the most common version of it. But for the general population, at the highest estimation, its prevalence is 1 in 3,100 people, which is about 0.3% prevalence. So HEDS, so hypermobility Ehlers-Danlos syndrome, is only about 0.03% of the general population have it. But HEDS in autistic people is around 6.5 to 8%, with 80% of people who are autistic thought to have hypermobility at some level. Now, lots of people have hypermobility, but it's only about 10 to 20% of the general population, but 80% of autistic people are thought to have hypermobility, which is the ability to do things like this, where you can put your thumb to your, but that you can have that have hypermobility, and it's just hypermobility. There may be nothing else attached to it. This changes the numbers from 1 in 3,100 to somewhere between 1 in 12 and 1 in 16. So very quickly those numbers change, and prevalence becomes more and more likely. Often GPs are not aware of these prevalence levels, as they are specific studies for specific conditions. Plus, the NHS is rubbish at updating these stats if it only affects a small subset of people, which obviously autistic people are only about 2% of the population. So you're talking about between 6.5% and 8% of 2% of the population. So they're not necessarily going to be looking at it. Studies are looking at it, but it's not being looked at from an NHS perspective to make those links. And we are often that link for the GP to take the leap into understanding it. And sometimes we have to sort of push them to understand the fact that there is this link. And I had to kind of push that and said, as an autistic person, and gave the stats. She was like, okay, yeah, it makes more sense that the prevalence level is much higher. 1 in 12 to 1 in 16 is much more likely, obviously, than 1 in 3,100. So this kind of brings me on to medical records. I've kind of touched on it, but you must get access to your medical records if you're going through this kind of situation and you're feeling that potentially you are being... It's a really good idea to do anyway. I didn't until very, very recently. And it was actually only when I was getting my autism assessment that I actually got my medical records, because I hadn't necessarily thought I needed them previously. And so getting your digital access to medical records, this will allow you to make links that for some reason the NHS system has no way of doing, because for some reason they don't link all of these symptoms together unless it's put together in one diagnostic sort of thought process from the doctor. It doesn't necessarily link it. It might do. There are certain flags that come up, like if you're taking certain medications, it'll tell you not to take another medication. And there are sort of high level things things like cancers, which it will flag up if you have things in a blood test that show that could potentially be cancer. It will come up. But in general, it doesn't necessarily do that, and it doesn't do it for all things. I'm really hoping that the new measures that they're putting in place, that the government are talking about when they're talking about systems and using better systems in the NHS, I'm hoping this is one of the things that it will do. I doubt it, and even if they do, I don't think it will work. Also, a really big point from mine is I still to this day have 10 years worth of my medical records missing, and nobody can find them. Nobody knows where they are. I've contacted the GP that I was at before. My GP's contacted them. There's no way they seem to just be lost. They were in the transition period between when they had to start doing digital records, and they seem to have lost all of them. So the reason why I'm saying this is really important is because I would never have known a lot of this stuff or sort of put it all together, and my GP wasn't picking up on it. So had I not got these, I would have not known the following. So the first one is in relation to when I was getting my autism assessment, and that was I had a referral for behavioural issues on five occasions from school, and no follow-up at all can be found anywhere. We can't find it at all that there was ever any follow-up on it. There were 13 incidents of shoulder pain marked as minor, when in fact that I was unable to move for weeks or move it for weeks or months. One of the times it was about 4 or 5 months that I wasn't able to move my shoulder at all, more than that. And so therefore should have been classed as major and classed as minor, therefore less likely to come up as something to look at. 4 incidents of dislocated elbows that I didn't remember as a child, all of them put as minor. Again, dislocation, don't see how a dislocation is minor in a child. 3 times as a child having a locked knee, which I didn't remember. And there are times I went to the doctors with it. I've spoken to my mum since. She was like, yeah, you needed lock a lot when you were a kid. It was only when it got really bad that we took you to the hospital. 17 times I had issues with my feet, including tendonitis, and 1 suspected tendinopathy. That's the one. Tendinopathy, which is basically prolonged. Allergic reactions to things in the air, which actually in reality could be an immune response, but they aren't even on. They weren't even on my record until they were found. Those ones were found, but I don't know where they were. But they hadn't been put in allergies. They were in a note somewhere really random from when I was a child, but I was thought to be allergic to pesticides and washing powders and soaps and things like that. There was a lot of things, but then as I got older, I wasn't using those things, or I hadn't used soaps, or I get a reaction to something after I'd worn a jumper for 2 days, and it was like, well, why is it now? And it wasn't the jumper, it was something else that was going on, which is another medical condition that has been prevalent since been present since I was a child. Chronic headaches for years as a child that I didn't remember. Severe RLS, so restless leg syndrome as a child. Again, that can show an autoimmune condition. I was also referred to a musculoskeletal specialist twice by the worst doctor that I've ever had. They were a nightmare. They never once made a note. They did refer me, but they never made one note on the 2 years that I had that doctor. There was no notes on anything, but they sent me to see a musculoskeletal specialist and a musculoskeletal surgeon. But they'd sent it to the wrong address. So they sent it to my previous address, even though my address was correct on the system at that point. We can't work out why they sent it to the wrong address, but that's why I never got them and never ended up going to the doctors. And me being me, I couldn't face fighting it. So yeah, that was that. And there's much more. And I said, who knows what is in that lost decade? What's there that the whole 10 years where it's missing? What was there that I don't remember? These things happen in isolation, so I don't link them together. So in reality, me going through my medical notes and sort of remembering those things, who's best placed, me or the doctor, to be able to put those things in place and be able to remember other times that happened? My doctor can't make a true estimation of things when they've got all of this missing information and lots of bits of faff on things that don't make any sense. And there's 10 years missing, and there's lots of missing notes from appointments. There was one where I had like 4 appointments in 1 week, but there was no notes on anything to say what the appointments were for, which is just ridiculous. So it's allowed me to piece a lot of things together with the help of my doctor to go through things. But that was after I'd gone through quite a bit of gaslighting of telling me that it was not likely at all that I had EDS, and then I ended up having EDS. So in conclusion of this very long video, I knew it would end up being quite a long one. None of us like being a pain, but if you were like me, you went a long time before getting your health sorted, and you deserve the correct treatment. Often it is not the GP not wanting to help; it is often the system and their lack of knowledge in a certain area. Always make sure that everything you discuss is noted up and get access to your full medical records. Then you can check and chase it if it is not added as agreed. Be confident if you really have researched something because you have the symptom, because you have those symptoms. Not that you are just trying to fit a diagnosis, but that it truly resonates with your health reality. Push and keep pushing. Do not stop until your doctor actually listens to you. And be as informed as possible. Make sure you can rebut anything they may throw at you. To deflect, and be aware that they do this. They do try to deflect, and going into it knowing that you're going to have to rebut anything that they say in response to it, and having things like that diagnosis criteria, as I mentioned earlier, can be really helpful for that, because you can refer back to something that's medical. So yeah, that's just my opinion on this. It's something that's really frustrating and it's annoying, but I do think you can tackle it by sort of these things that I've talked about, and I'm sure loads of other people have got loads of other opinions on this, and they've got their own lived experience that they can share with you. But if you are facing it, I'm sorry that you're having to go through that, because it is a nightmare. It is a horrible thing to have to deal with. And I do think it is even more problematic for people who are autistic because of the social interaction and that type of thing as well. So thank you very much. I hope you've enjoyed the video. If you could comment, as I said, that would be great. If you could like, share, subscribe, that would all be great as well, but don't worry about it too much. Thank you very much, and I hope to see you on the next video. Thanks. Bye.